Welcome to the Deep Dive. This is where we take your sources, could be articles, research, even your own notes, and we really boil them down to the essentials. Our goal is simple: give you that shortcut to being genuinely informed, maybe share a surprising fact or two, and hopefully keep it interesting along the way. Today we're diving into something really important, something that affects so many people: understanding anxiety and depressive disorders. Okay, let's unpack this. So our mission with this one, using this booklet, Anxiety and Depression, is to give you a clear, kind of concise overview of these conditions. Whether it's for you personally, or maybe you're supporting a friend, a family member, we just want you to come away feeling, empowered and well-informed.
And what's fascinating here, I think, is how common feelings like sadness, loneliness, fear, even anxiety are. They're totally normal reactions, right? Life throws things at us: a death in the family, losing your job, divorce, financial stress, a sick child. These feelings make sense then. They usually fade. But, and this is the critical point the source makes, it's when those feelings stick around and start to really interfere with your day-to-day life, that's when you might be dealing with an anxiety disorder or depression, or sometimes both together.
And if that resonates with you, the main message here is you are definitely not alone. The booklet points out a really striking statistic: about half, 50% of people diagnosed with depression also get diagnosed with an anxiety disorder.
Yeah.
That overlap is huge. And it also mentions that women seem to be more likely than men to experience both depression and an anxiety disorder.
Yeah, it lays out that data pretty clearly, and it really emphasizes how debilitating these conditions can be when they occur together. It's not just, feeling a bit off. It can genuinely disrupt your life, caring for family, focusing at work or school. But here's the hopeful part, and the source is very clear on this. These disorders, they're real, they're serious, absolutely. But they can be treated, together or separately. There really is hope. Finding the right treatment makes a massive difference in getting better.
Okay, so let's talk about anxiety first. When does that normal worry cross the line? Because anxiety itself, well, it's a standard biological thing, a reaction to stress. It's actually important for living. It helps us, jump out of the way of danger, get ready for big events, warns us when we need to act, like that jolt you get when you nearly miss a step. That's anxiety working.
Exactly. It serves a purpose. But connecting this to the bigger picture, it becomes a disorder when that response is just constant, when the source describes it as persistent, irrational, seemingly uncontrollable, and overwhelming, or an excessive, irrational dread of everyday situations. That's when it stops being helpful and starts being disabling, really interfering with just living your
But
life.
it's not just one single thing, right? The booklet breaks it down. It lists several specific types: generalized anxiety disorder, or GAD, obsessive compulsive disorder, OCD, panic disorder, PTSD, post-traumatic stress disorder, also social anxiety disorder, which some people call social phobia, and specific phobias too.
And the scale here is, well, it's significant. We're talking more than 40 million adults in the U.S. affected by anxiety disorders. And it's key to understand, as the source notes, these often have a biological basis. They can run in families, much like allergies or diabetes, it says. Which is such a helpful comparison, isn't it?
It really is. It frames it as a health condition, not a personal failing.
Yeah.
Takes away some of that blame.
Exactly. It destigmatizes it right there. They're real, serious disorders, but importantly, they are treatable.
Okay, let's shift gears a bit and talk about depression. Depressive disorders.
Hmm.
We all get the blues, feel down sometimes, that's normal. But clinical depression, as our source defines it, is more persistent. It's characterized by ongoing feelings of sadness, being discouraged, hopeless, unmotivated, often a real lack of interest or pleasure in life generally. The key difference is when these feelings hang around for more than 2 weeks and they mess with your regular daily activities. That's when it's likely a depressive disorder.
And this brings up a really important, quite sobering point. Why is getting diagnosed early, getting the right treatment, so critical? Well, the source cites research showing that over 90% of people who die by suicide have a diagnosable mental disorder.
Wow.
That statistic alone really underscores the seriousness and the need for timely intervention.
So what are the main types the source talks about? It mentions 3 main depressive disorders, also called mood disorders. There's major depression, dysthymia, and bipolar disorder. And again, any of these can show up alongside an anxiety disorder. The numbers are pretty significant too. Major depression, about 14.8 million American adults. Dysthymia, around 3.3 million. And bipolar disorder affects about 5.7 million adults.
Let's dig into major depression a bit more. This isn't just sadness, it's a combination of symptoms that are genuinely disabling. They interfere with your ability to function, work, study, even basic things like eating and sleeping. It might happen just once, or it can recur throughout life. Often it's linked to a major life event like a death, a breakup, a serious illness, but not always. And what's interesting, and something the source points out, is that some people mainly experience physical symptoms, like persistent aches and pains they can't explain.
Right, physical aches. That's probably missed quite often, I'd imagine.
Very often, people might see doctor after doctor for a physical cause.
So what does that disabling combination actually feel like? The source lists quite a few symptoms. Maybe we can highlight some core ones. Like, it's not just sadness, but a persistent, sad, anxious, or kind of empty feeling. Or losing interest in things you used to enjoy, hobbies, activities, even sex.
Exactly. And changes in energy, feeling fatigued, slowed down, difficulty concentrating, making decisions. Sleep problems are common too, either insomnia, waking up very early, or sleeping way too much.
Appetite changes as well, right? Eating too little and losing weight, or the opposite, overeating and gaining weight.
Yes. And crucially, thoughts of death or suicide or actual suicide attempts. Restlessness, irritability can also be part of it. And those persistent physical symptoms we mentioned, headaches, digestive issues, pain with no clear cause.
It really paints a picture of how differently it can manifest. Depression isn't monolithic at all.
Absolutely not. It's very individual. Then there's dysthemia or dystemic disorder. This is described as a more chronic, kind of low-grade form of depression. It usually goes on for at least 2 years. It's less severe than major depression, but it involves similar symptoms, mainly things like low energy, appetite changes again, too little or too much, and sleep issues. The source also notes it can show up as just seeming stressed all the time, irritable, and maybe a mild anhedonia that's finding it hard to feel pleasure in things, like a constant gray background noise.
A persistent gray cloud, yeah, that makes sense. As opposed to the storm of major depression.
Yeah.
And the third type mentioned is bipolar disorder. This used to be called manic depression. It's characterized by these major mood shifts, right? From severe highs, which are called mania, or sometimes milder highs, hypomania, all the way down to severe lows, the depressive episodes.
That's right. And during that manic phase, the symptoms are quite distinct. You might see abnormal or excessive happiness or elation, but also extreme irritability. A much decreased need for sleep is classic. Grandiose ideas, talking really fast, racing thoughts, increased sexual desire, huge surge in energy, but also poor judgment, maybe inappropriate social behavior. It's like everything is amplified, turned way up.
Almost like the opposite of depression in some ways.
In some ways, yes. And then during the depressive phase, the person experiences those symptoms we discussed for major depression. These mood swings, they can shift gradually over time or sometimes quite suddenly, abruptly.
Okay, so we've laid out what these conditions look like, the different types, how many people are affected. It can sound pretty overwhelming. But, and this is really important, the source hammers this point home. Anxiety and depression are highly treatable. That's the core message here, I think. There's real hope, therapy works, medications work, often a combination is best.
Absolutely. And the key is tailored treatment. It needs to fit your specific diagnosis, your individual needs. The goal is to help you manage and reduce the symptoms of potentially both disorders if they're co-occurring. So that first step is vital, getting an accurate diagnosis, and then working with a professional to figure out the best course of treatment for you.
Let's talk about therapy first. What does the source say works? It really highlights cognitive behavioral therapy, CBT, describes it as a short-term psychotherapy that's often very effective. Basically, CBT teaches you different ways of thinking, reacting, how to replace those negative, unhelpful thought patterns with more realistic, useful ones. Often involves facing fears gradually.
Right. And CBT isn't the only effective approach. The source also mentions interpersonal therapy, or IPT, acceptance and commitment therapy, ACT, and dialectical behavioral therapy, DBT. Different approaches for different needs.
And there are other specific therapies too. I thought this was interesting. Recent studies suggest attention training, like training your focus, can be as effective as CBT or meds for GAD and social anxiety. And it can help with depression symptoms too.
That's fascinating. It shows how varied the effective tools can be.
Yeah. And then there's family therapy, looking at family dynamics, and relaxation techniques, things like breathing exercises, muscle relaxation, even just regular exercise. Simple, but they can really help you cope with stress.
And for bipolar disorder specifically, the source mentions interpersonal and social rhythm therapy. This focuses heavily on maintaining a really regular daily schedule, sleep, meals, activities, and keeping personal relationships stable. Routine is key there.
Okay, what about medication? That's often a big part of treatment too.
Yes, and the source points out that medications can be very effective, especially when symptoms of anxiety and depression occur together. SSRIs, selective serotonin reuptake inhibitors, and SNRI, serotonin norepinephrine reuptake inhibitors, are mentioned as often working well for both. You can think of them as helping to adjust the levels of certain chemical messengers in the brain. They tend to have fewer side effects than older types of antidepressants.
And it takes time for them to work, right? It's not instant.
Exactly. It usually takes 2 to 4 weeks to feel the full effect, and finding the right dose might take some adjustment over several weeks too. And crucially, this is really important. Even when you start feeling better, you have to keep taking the medication as prescribed.
Don't just stop on your own.
Absolutely not. Any changes, switching meds, stopping, that must be done under a doctor's supervision. Withdrawal can be difficult and symptoms can return. Now, medication for bipolar disorder is a different ballgame. Getting that correct diagnosis is absolutely critical first, because unlike with depression or anxiety alone, just taking a standard antidepressant can actually make bipolar symptoms worse, potentially triggering mania.
Oh, wow. Okay.
Yeah. And untreated or improperly treated bipolar disorder tends to worsen over time. Episodes can become more frequent, more severe, and sadly, it increases the risk of substance abuse and suicide attempts, so proper treatment is vital.
Are there other types of meds mentioned?
Yes, benzodiazepines are brought up. They're a class of drugs often used for anxiety disorders, like Xanax or Valium. People might know those names. They don't seem to negatively affect bipolar disorder, which is good. But they come with their own issues. There's the potential for physical dependence and tolerance, meaning you need more over time. And there's some risk of abuse, especially for people with a history of alcohol or substance problems. So they're used carefully.
And we should also mention the FDA warnings, the Food and Drug Administration. The source notes that back in 2004, the FDA issued a warning about antidepressant meds, including SSRIs, saying they might increase suicidal thoughts and behavior in a small number of kids and teens.
Right, and then in 2007, a similar warning was proposed for young adults ages 18 to 24, particularly during the first month or two of treatment.
So the takeaway is just talk to your doctor. Discuss any concerns. They can monitor things closely.
Absolutely. Open communication with your doctor is key. The source also touches on complementary and alternative medicine, or CAM, it clarifies the terms. Complementary means used alongside conventional medicine, like using aromatherapy maybe to help with anxiety before a procedure. Alternative means used instead of conventional medicine, like, say, trying a special diet for cancer instead of chemo, which is obviously a much bigger decision.
So what CAM approaches are mentioned for anxiety or depression?
Well, it mentions the plant kava has shown some effectiveness for anxiety symptoms. Evidence for acupuncture is apparently getting stronger. And yoga, combining postures, breathing, meditation, is a popular TAM practice that many find helpful.
But the advice is always the same, right? Check first.
Always. Talk to your mental health provider or your primary care doctor before starting any CAM treatment. Make sure it's safe and won't interfere with other treatments.
Beyond doctors and therapies, what about self-help? Things you can do yourself. The source actually gives 10 pretty practical tips for stress reduction. Some seem obvious, like eat well-balanced meals, get enough sleep.
But they're foundational, aren't they? Eating well genuinely affects brain chemistry. Sleep resets everything.
True. And others are more about mindset, like do your best instead of trying to be perfect, or accept that you cannot control everything. That's a big one for anxiety.
Huge. And learn what triggers your anxiety. Knowing your triggers gives you power.
Also simple things like take a time out, take deep breaths, count to 10 slowly. Things you can do in the moment.
Yeah, and welcome humor. Maintain a positive attitude. These aren't about ignoring problems, but about building resilience, shifting perspective.
That's a good list. Practical stuff that reminds you self-care is actually a strategy.
And supporting others is a huge piece of this, too. If it's a family member or a loved one going through it, your support is incredibly important for their recovery. The source gives some really concrete advice here. First, learn about the disorders yourself. Understanding helps. Recognize and praise small accomplishments. Recovery isn't always linear.
Yeah, focusing on improvement, not perfection.
Exactly. Modify your expectations during stressful times. Don't push too hard. Measure progress based on their individual improvement, not against some external standard. And try to be flexible, but also maintain a sense of normal routine where possible. Predictability can be comforting.
What about kids? The source mentions they can develop these disorders too.
Yes, children and adolescents absolutely can, and sometimes it occurs alongside other things like ADHD or eating disorders.
And they might complain about physical stuff more, like stomach aches.
That's right. Headaches, stomach aches can be common signs in kids. So you need to look for changes.
Like changes in eating, sleeping, schoolwork.
Exactly. Or their activity level, their mood, how they're getting along with family or friends.
Increased aggression. Or maybe acting younger than their age.
Yes, or even changes in speech or hitting developmental milestones. If you see persistent changes in those areas, it's worth getting an evaluation. For college students specifically, the advice is to check out the mental health resources available on campus or in the community. Most colleges have counseling centers, but, and this is a key point, especially for young adults, it's really important they feel like getting treatment is their decision.
Right, you can't force it. You can offer support, information.
Exactly. Share info, be patient, let them come to it. The decision has to feel like their own for it to stick.
Okay, so you've decided to seek help.
Mhm.
How do you actually find a therapist? Who does this work?
Well, the good news is there are many types of trained professionals: doctors, therapists, counselors, clinical social workers, psychiatrists who can prescribe medication, and psychologists.
Where do you start looking?
The source gives several good starting points. A great one is the Anxiety and Depression Association of America website, adaa.org. They have a Find a Therapist tool you can search by zip code.
Okay, adaa.org.
Yep. You can also ask your regular doctor, your primary care physician, for a referral. They often know good local specialists. Look for local support groups. Again, adaa.org is a resource for that. Connecting with others can lead to recommendations.
What about insurance?
Contact your health insurance company. They'll have a list of providers in your network. Or check with local hospitals or universities. They often have mental health clinics or staff professionals you can consult.
And when you find someone and have that first consultation, it helps to be prepared, right? Have questions ready.
Definitely. Being prepared helps you assess if it's a good fit. The source suggests asking things like, what's your training and experience specifically with anxiety and depression? What's your general approach to treatment?
Can you prescribe medication or refer me if needed? How long does treatment usually last?
Good ones. Also, will I be able to keep up with work or school? How often are sessions? How long are they? How will we know if treatment is working? What are your fees? Do you offer a sliding scale based on income? What insurance do you take?
Asking those questions up front can save a lot of hassle later and helps you feel confident in your choice.
Absolutely. It empowers you in the process.
And throughout this, the Anxiety Disorders Association of America, ADA, keeps coming up as a key resource.
It's really is positioned as a central hub in the material.
So visiting their website, www.ada.org, seems like a really practical step. You can sign up for their e-newsletter, find therapists, support groups, clinical trials, and even read personal stories from people who've navigated this, which can be incredibly hopeful.
Yeah, seeing that others have come through it can make a huge difference.
So what does this all mean? We've covered a lot of ground here. This deep dive really shows that, yes, anxiety and depressive disorders are serious. They can feel absolutely crippling at times. But the overwhelming message is one of hope. They're profoundly treatable. And often, that path to feeling better starts simply with getting good information, like this, and then taking that first step towards help.
What's fascinating here is seeing that while the journey to recovery is unique for everyone,